पंजाबी में बोलते हैं कि कलेजे विच ठंड पै गई। तो क्या हुआ, इतना 2-2 डिग्री लेने के बाद कुछ शांति नहीं पड़ी आपको? आपने लेज़र्स, डोंट यू थिंक डेंटिस्ट्री में ना लोगों को लेज़र्स का समझ नहीं आता है? कुछ लोग गिमिक बोल देते हैं, कुछ लोग उसको सुपर हाइप करके रखते हैं।
People don't pay for procedures. People pay.
What was your why into getting involved in the dental field itself?
This will sound a bit cliche, but I have been noticing. MBA helped me know that dentistry or a dental setup is not just a chair and a drill. It's a mini healthcare system in itself.
जो नॉर्मल पेशेंट और डॉक्टर का एक पर्सपेक्टिव रहता है, कुछ सस्ता, सुंदर, टिकाऊ दिखाओ।
Yeah.
तो उसमें how do you find balance?
I don't tell my staff to sell lasers. I always tell them to introduce to the patient it as a kinder option.
कुछ ऐसा बताओ जो रेवेन्यूज में हेल्प करे। कोई ऐसे 5 क्वेश्चंस हैं जो लोगों को खुद से पूछने चाहिए while investing in lasers. How do you see a person? कोई एक एडवाइस देनी हो फॉर द नेक्स्ट 90 डेज, किसी को अपना कंटेंट प्लान करना है, कैसे वो अपने आप को प्रेजेंट कर सकते हैं इन द सोशल वर्ल्ड?
So I'll give this as my own example. One very important thing, don't think that you have to get viral on social media. So the biggest people who will actually choose you will silently DM you and not be liking your post. So don't go into that thing that, oh, I have to get viral with this. No, you're there to solve a problem. You're not an influencer.
Most bios are just noise. A patient do not choose you for your tags and trophies. They choose you for a clear promise from hello and to follow up. Hi, and welcome to the 4th episode of season 5 on the Underdog Dentist Show. I'm your host, Dr. Girish Likhiani. Today, we turn your why into something people can feel and repeat. It's not a speech, it's a system. Here is where we are going. We will craft 6-word promise with 2 guardrails, and we will place this in a triage, consult, and follow up so that every line points in one direction. We will show you how to teach your team so that they can speak the same spine, how to track 3 numbers that matters the most, and how to use simple proof so trust builds without even pushing. If you want calmer rooms with cleaner decisions, this is your playbook. Let's take a deep dive. And to all those who are listening or watching this show for the very first time, follow wherever you are listening or watching and share this episode with a friend of yours. Enjoy the show. Knock, knock.
Who's there?
You.
You who?
Exactly. वही हम लोग यहाँ डिस्कस करने वाले हैं. And how excited she is after being on the podcast. So, welcome to the 4th episode of season 5 on the Underdog Dentist Show. Today we have with us Dr. Manasvi Behel. So, I know Dr. Manasvi, I think I lost count on the number of years now. So, maybe around 2020, 2021, we got in touch with some, fundamental about marketing. I guess the time was difficult for a lot of practitioners, especially in the times of COVID-19, when almost everyone was under lockdown. And I feel we launched a workshop for everyone. We called it the Founders Den Workshop. I think that's what the time where I can, exactly recall where we kind of met and discussed a lot of perspectives in social media marketing or the kind of Instagram that we were helping the doctors and dentists with. So, Dr. Manasvi is here. She is fantastic dentist working in her clinic in Noida, Sector 41. She is like my family itself, and I have a lot to say about her, but I'll just say that she's a great dentist, and we will be talking about and discussing about her journey, how she looks dentistry as a whole, and what you can learn from her. So, hi, Dr. Manasvi. Welcome to the Underdog Dentist Show.
Thank you for having me. It's a pleasure.
So, let's just start off with the questions, and I feel let's keep it very candid, very, casual, and so that, a lot of youngsters and people who are looking up to you and looking up to the profession finds this particular podcast helpful for them, as especially for their careers and how they want to take dentistry ahead. So instead of playing the Karan Johar, I'll play myself. I'll act very casual and just a friendly discussion. Yeah. Into things. Let's say if a youngster is watching you right now and maybe he or she wants to talk to you and having a first conversation with you. For someone meeting you for the first time, what's your story and what does a family dentist mean to you, and what you want to portray and what you want the world to know about you?
So, my story is very simple. I am a dentist who believes that dentistry should be gentle, safe, and deeply healing. I'm a family dentist. That means I cater to or take care of patients across age groups. And my clinic actually takes care of everyday families. And I'm a family dentist who fell in love with lasers. And lasers actually helps me heal people by reducing their pain, their anxiety or any fear, because I realized in my journey that people don't pay for procedures, people pay to feel safe again. So in real life, I'm a family dentist with a laser focus, which means I listen to them first, treat them thoughtfully, and I make sure every person who walks out of the practice is lot calmer than when they entered.
Okay. So you're also telling me that we are going to talk about lasers.
Yes.
Okay, got it. And as we discussed that we are not gonna keep this very formal and mostly we'll be picking up Hindi at times. So I'm gonna ask the next question in a mixed language here.
Yeah.
So ऐसी कौन सी चीज़ है जो पेशेंट्स देखते हैं और यू नो दे डोंट नो अबाउट यू but your closest friend knows much more about you, and let's not connect dentistry too much here. Let's divulge into the kind of relationships you have with the patients and kind of meaningful communications you have with your closest of friends.
Yeah. So I'll have to go a bit to my childhood for that. So I've been a very poor eater, and then there was a shift. I became a foodie.
Okay.
So for anything I have to do, I have to eat food. So my friends know that, and my friends know one more thing, that I can pause mid meal to record a content. I mean, if something comes up into my mind, and I will like, okay, let me just pause and shoot this, because this can make dentistry helpful for my audience and for my patients. So that's what I do. So my actually patients see me as a very calm clinician, not very this thing into the digital space. But however, my friends know that I am a bit of a nerdy filmmaker who sees content everywhere, literally.
Spoiler, I don't see you that way, but yeah, okay.
You don't?
Yeah.
You tell me then, what do you know about me?
I think you are somebody who deeply cares about people, and you care about how you are with those people, and you always believe in doing the right thing and the justice to almost every soul that you meet.
Oh, I'm so grateful to know that. Really, my heart is full.
You've spoken about the habit that you had. So dentistry कहीं यहीं से तो नहीं आ रही? Like, why did you get into dentistry, and what was your why into getting involved in the dental field itself?
This will sound a bit cliche, but I have been noticing people's smiles ever since I was a child. Since childhood, I've been noticing more than their names. I'm very bad with
So we
names.
can say you are a born
Could be.
dentist, yeah.
Could be, because I notice their smile and then I may forget their name, but then, okay, this way this person laughs or smiles. So that's one. And, but then obviously, when I chose dentistry, I realized one very important thing, that dentistry actually sits at the intersection where you're a doctor. You can be a skilled artist. You have to be a skilled artist, actually, and a bit of a therapist. Like you said, I care for. So I care for my patients also. They know that. So a bit of therapist all at once. And when I chose this field, and what was the turning point for me, if I can say? So the turning point for me was when I realized that I'm not treating just the teeth or just the mouth, I'm treating the person as a whole. So I believe that I'm more than just using a handpiece. So I am someone who would believe in connections. So yeah.
Nice. I can totally see that, she's not lying. But if you were to ask this question to me, I would have just said कि medicine नहीं मिली तो dentistry कर ली. But okay.
No, but I was very clear. I want
Yeah,
to
yeah,
get
I can totally believe that. And the kind of work that you do and the kind of dedication you have totally speaks for the kind of, dedication and hard work that you put in dentistry.
you. Thank you.
ओके, सो मैं मेरी स्टोरी बता रहा था
हाँ.
कि अगर मुझसे कोई पूछता कि आप डेंटिस्ट्री में क्यों हो, तो शायद मैं बात को टालने के लिए बोल देता कि हाँ, जस्ट बिकॉज मेडिसिन नहीं मिली एंड दैट इज़ मे बी द रीज़न आई एम इन टू डेंटिस्ट्री. बट इवन दो हमको मोस्टली मतलब दिस इज़ द जनरल कंसेंसस दैट हमको मेडिसिन नहीं मिली एंड दैट इज़ वाई वी आर इन टू डेंटिस्ट्री, एंड मोस्ट ऑफ द मेडिकल प्रैक्टिशनर्स ऑल्सो थिंक लाइक दैट. If I also have to take a deep dive and see why I'm in dentistry and why the entire universe made me
Made you do that. Yeah.
made me do dentistry later, I can also see that I have a connection. I also see that I get connected to people very easily. I want to give the same kind of care that I give my family to almost everyone around me. And maybe I'm a very bad businessman when it comes to healthcare. Yeah, that is one more reason.
I don't agree. I don't.
Okay, we'll.
No, no, I agree to the point where you want to connect with people. You do because you have a beautiful heart. You do that, but you're equally good at marketing and at the sales part.
I'm good at snatching money from people who are into healthcare, but I'm not good at snatching money from the patients. That is what I want to say. But okay, we get it. So, apart from doing your BDS, you did um, MBA in healthcare services. You also did a PG diploma in epidemiology. Can you tell me and tell everyone who is listening why PG diploma, and then why you went ahead with the MBA in healthcare services? What was your why you did that, and how it is helping you shape your career today, how you are managing your practice is, you know if your PG diploma is helping you today, or if your MBA in healthcare service is somehow helping you in the entire
Skip.
journey and whatever you are doing right now with the patients. Again, I think I have gone beyond the boundary lines here, but yeah, if you want, you can explain at length.
Yeah, definitely. So, epidemiology actually taught me to see patterns. So, why people avoid care, where fear lives, what is that habit that is running from generation to generations. MBA, for that matter, helped me know that dentistry or dental setup is not just a chair and a drill. It is much more than that. It's a mini healthcare system in itself, and it also grounded me in reality by I got to know that a dental clinic will not run on good intentions. It has to have systems. So combined, if I see, I think my practice today is become more evidence driven, ethical, and sustainable. Yeah, because of these two.
Right.
Yeah.
So systems and having a retrospective study of the entire family through epidemiology.
Yeah.
This is an interesting concept, and I'm sure you must be employing these things into your day-to-day practice in dentistry. Nice. Moving on. पंजाबी में बोलते हैं कि कलेजे विच ठंड पै गई. तो क्या हुआ, इतना 2-2 डिग्री लेने के बाद कुछ शांति नहीं पड़ी आपको? आपने लेजर्स भी सीख लिया, मतलब ऐसा क्या रीज़न था कि यू वेंट अहेड विद लेजर्स एंड you know you are snatching patients from other practices? What's that reason? Yeah.
Aho. So, lasers, actually, I welcomed lasers 5 years ago in my practice. And laser was not for the hype. I felt it was a necessity in my practice because I was seeing a lot of anxious patients, and I was also seeing a lot of people who were medically compromised, and in cases where conventional methods felt too aggressive. So lasers in my practice was really problem solver, if I can say that, and that's why I leaned into lasers in
Okay.
dentistry. Yeah.
But don't you think dentistry में ना लोगों को lasers का समझ नहीं आता है? कुछ लोग गिमिक बोल देते हैं,
That's true.
कुछ लोग उसको सुपर हाइप करके रखते हैं.
Yeah.
तो वेयर इज दैट थिन लाइन जहाँ पे यू फाइंड बैलेंस इन both of these things?
Yeah. So when I actually talk about dentists only, if I say so, there's one thing about the lasers. They think it's a shortcut. They either think it's a shortcut to faster healing, or they think it's a shortcut to premium pricing.
Okay.
So actually, when we see a scalpel can separate tissues faster. Where laser wins, it wins in healing those tissues faster. And that's what the patient wants. Patient wants quicker recovery, right? And one more thing, I think dentists and normal people also feel that laser is a surgical tool or it's a cosmetology treatments. However, that's not there. In almost every aspect of dentistry, we can use lasers, and not just the surgical part of it. There is photobiomodulation wherein it can be used for healing. In fact, a lot of young dentists make this mistake. They think, let me buy the laser, I'll be a laser owner and an expert laser specialist, but that's not the case. Just buying a machine and plugging it in will not make you a magician. You will have to learn the process, you will have to put in the training hours and the practice, and definitely you need mentors to do that. Otherwise, you will just have an expensive gadget in your hand and not a kinder experience for the person in chair. That is your patient.
Nice. Abhi, like listening to you, I got two follow-up questions. One is जो नॉर्मल पेशेंट और डॉक्टर का एक पर्सपेक्टिव रहता है, कुछ सस्ता सुंदर टिकाऊ दिखाओ,
Yeah.
तो उसमें हाउ डू यू फाइंड बैलेंस कमिंग फ्रॉम बोथ द डेंटिस्ट एंड द पेशेंट पर्सपेक्टिव? मोस्ट डेंटिस्ट find lasers expensive. Similarly, most patient finds laser treatment expensive. How do you find balance in both of these things?
So my practice runs with the golden rule. So my staff actually introduces lasers to the patient.
Wow.
So we always say that it's a kinder option compared to the conventional method. And we always talk about the outcome. We say you don't see the treatment. Like I told you in the beginning, people don't pay for treatment. People pay to feel safe again. So we say the outcome, which is faster healing, no bleeding, no pain, no problem at the end. So you'll be returning to your life sooner, right? Your normal routine will start sooner. So when they see the outcome, they find this treatment very valuable. It's not expensive, it's a smart thing. So that's how.
Nice.
So,
Abhi, I liked one line that you said patient wants a safer treatment option.
yeah.
So इसका मतलब ये नहीं है ट्रीटमेंट नहीं कराना. That's the safest thing ever. ठीक है,
Yeah.
ट्रीटमेंट कराओ and then you know.
Ignorance is bliss. So वो नहीं. If you need treatment, you have to see the dentist. We will make sure which is the safer option for you.
तो अभी कुछ ना शैतान लोग होंगे मेरी तरह जो ये सोच रहे होंगे शी सेड कि यू नो lasers can treat almost everything and it can be used from you know ground up like from for every kind of dental exploration or maybe dental treatment. तो अब जो मेरी तरह शैतान लोग होंगे वो ये सोच रहे होंगे कि कंसल्टेशंस में डेंटल लेजर्स को कैसे यूज़ करते हैं. तो आई विल गिव यू एन आंसर फ्रॉम द मार्केटिंग पर्सपेक्टिव फर्स्ट एंड देन विल मूव ऑन टू डॉक्टर मनस्वी. When a patient looks up for a dental treatment, उनको ना bombard कर देते हैं with a lot of things like lasers, get laser teeth whitening, get laser XYZ treatment done. And patient normally फ़ोन करके यही बोलता है सर मुझे लेज़र एक्सट्रैक्शन कराना है. तो अब इस चीज़ का कोई जवाब मोस्टली हम लोगों के पास नहीं होता है बिकॉज लेज़र एक्सट्रैक्शन हम लोगों ने टेक्स्ट बुक में कहीं नहीं पढ़ा है. So the marketing jargon or the kind of promotions people are doing on maybe social media or websites says a lot about lasers. But there are implications of lasers in certain sectors जहाँ पे we can explore lasers to the maximum. But there is also misinformation available online. So during consultation, I feel your real goal as a person who is deeply invested into lasers is to guide the patient in the right manner, to tell the patient that laser extraction या laser XYZ surgery, that is ठीक है. It's just a marketing jargon. Technically how that is feasible or not at the moment, we are unaware of that. If somebody else is doing, we would love to learn that technology as early as possible. Moving on to Dr. Manasvi.
So yeah, laser extraction, or say laser will not extract the tooth, but laser will help with the healing. So we can give, if when we are giving anesthesia, that's when we give lasers for healing. Once the procedure is done, we do lasers for better healing, better results, better outcomes. So that's the rule. So laser is not there to take away the conventional things, right? It is helping it. It's actually improving the patient's trust, it's improving the patient's overall experience. That's where the laser fits into a dental practice. It's not there to replace treatments. No, it is going to assist and is going to improve the total outcome.
Perfect. Moving on to myths now. एक तो मैंने बता दिया कि ऑनलाइन देखा और लेज़र से मुझे कुछ कराना है। मुझे लग रहा है लोग बाग शायद शादी भी आज लेज़र्स के थ्रू कर लेंगे, ऐसा कुछ उनको दिखने लगेगा।
Wow.
तो ठीक है, मतलब
That's
वही
new.
हाँ, तो वही मैं पूछना चाह रहा हूँ कि कोई ऐसा मिथ है जो बहुत कॉमन हो पेशेंट्स में, जो पेशेंट्स आके बोल देते हों एंड आपको समझ नहीं आता हो कि पता नहीं इसने कौन-सी बात मुझसे कह दी है जो मेरे बिल्कुल पल्ले नहीं पड़ रही है। सो व्हाट आर दोज़ मिथ्स दैट मोस्ट पेशेंट्स हैव एंड हाउ यू आर डीलिंग विद दोज़ मिथ्स?
So patients first don't understand what laser is. So they're laser. What is laser, madam? Light? So they think it's light. And the good part about lasers is it's a silent device. There is no drama, there is no noise, there is no pain, there is nothing that the patient is feeling at the time we are treating. So patient mostly feels ki whether it is also doing anything or no. They think it's an invisible science, right? So that's what they think. And how do I, as a clinician, make it visible? I tell to my patients, I show other people's journey. For example, a person with an ulcer came to me and I did 3 sessions of laser for healing, and then I show them the result.
Okay.
And if you come to a practice which doesn't have laser and they would just write down one gel and they will just say, okay, in 15 days, your ulcer will heal. And here we are. We're treating in three sessions. So we show them other people's journey. We show the outcomes and we show the before and after. So when they see that, the invisible signs become visible to them.
Got it. But again, मेरा थोड़ा दिमाग चलने लगा है. This is one type of journey that we are looking at right now. In this particular journey, you are educating the patient about lasers. What if the patient already has some kind of information? Maybe, he must have read on websites, social media, chat GPT. A lot of people do that nowadays. And I've seen a lot of people do this, that you are my dentist and act like a dentist. Tell me about this, that, and cost of everything. And can you also treat me for that matter? बट अगर जर्नी ऐसा है कि पेशेंट को ऑलरेडी कुछ इन्फॉर्मेशन है, मे बी मिस इन्फॉर्मेशन है, हाउ डू यू डील विद दैट एंड व्हाट आर दोज मिथ्स जो इन्फॉर्मेशन बायस के थ्रू आ रहे हैं?
So yeah, myth from bias does happen. People feel like people have this myth that we discussed earlier that laser is expensive. This is one very big myth they have. They feel, okay, the doctor is doing this for to earn money. Anyhow, the outcome is not going to be that. They have that thing in mind unless you actually treat them and show, okay. So for young dentists, I will say, in fact, introduce laser to them as a part of their experience. For initial cases, let that be the practice so that people know, okay, so this is something which is actually adding value to it. Once they trust you, you make them speak about it, get a written review or a testimonial. So for difficult cases, we do that. So to handle those cases, we have testimonials in place wherein if they have a similar case, we make them hear what people say. So that is a very powerful tool when patients hear other patients' journey in words. So that's when everything changes.
Nice.
People have a lot of misinformation, not just from AI. They have a lot of misinformation from social media also, from influencers, not the dental practitioners, I would say. So when they think that a certain procedure like lasers can be done for this thing, that thing, that has to be corrected. So unless we see clinically, unless we see that, yes, this can be treated with lasers, only then we will promise. We cannot overpromise something. There are certain limitations which we cannot generalize it under an umbrella term. Ki, okay, this thing is going to be done with that. No, it may assist in that treatment, but can we actually do that treatment with lasers? No, that has to be done once you're in the chair and we are clinically seeing you, and then decide.
Okay, interesting. And equally, I would say you are doing a commendable job at that. Okay, moving on. What changes do you actually feel, after a patient gets to know about lasers from you or gets the laser treatment done from you? Let's categorize this: effects with the pain perception, or effects with the fear that they have with lasers, or effect with the healing capacity of the entire tissue. Maybe, if we are looking at soft or the hard tissue, whatever.
So, generally, our patients tell us one thing, that they didn't have to reach out for the medicine after. So, that's one very big compliment. And the second thing, they are able to return to their routine faster. So, that tells that the healing was quicker. And one magical thing that they always tell, and that also makes the laser invisible, is that they do not feel anything while the procedure is going on. And if I may say so, there's also a silence in the mouth afterwards. So there is no pain or swelling or, as such, any post op difficulty to the patient afterwards. So their recovery, I can say, is quiet, calmer. That's where I think the trust grows louder.
Even the swelling and inflammation gets reduced.
Yes.
Yeah. So we talked about lasers. Kaise, she's doing lasers, and how the patient behaves and how the patient reacts, and what kind of information patient is looking for online when they are looking for lasers. चैट जीपीटी में क्या देखते हैं, और वो तो खैर ऐसी हिस्ट्री है जिसको कोई जानना नहीं चाहता. बट या, वेबसाइट्स पे क्या है, सोशल मीडिया पे क्या है, यूट्यूब पे क्या है, बट थोड़ा ग्रैनुलर जाता है, बिकॉज until unless we get the details of the granular insights of the entire workflow that Dr. Manasvi uses for her patients, or how patient interacts with her. Let's go step by step, right? Let's talk about the workflow that you have while dealing with the patient, when you are doing some kind of laser therapy or laser treatment.
So I will just walk you through. First step has to be diagnosis and documentation, thorough clinical exam with photos, followed by discussion with the patient. So we tell them that what is the conventional method, what we are doing differently with lasers. If it's about lasers, then what are the benefits? What will be the outcome? What will be the cost? And if there are any limitations. Once the patient agrees, then we talk about the informed consent. So we take a written informed consent. Whatever we discussed with the patients goes in writing, and the patient and we sign it. Then, when we start the laser procedure, we have to follow a laser safety protocol. And one of the main thing is wearing protective eyeglasses. The dentist will wear it. I, as a dentist, wear it. My assistant and the patient. So, patient wears it first, and then the two of us. So that's one part of it. And then we start the procedure, the laser procedure, and after that, post-op and healing. Whatever instructions we give to the patients is also given in WhatsApp,
Okay,
and then follow up the next day, fortnightly, like that.
perfect. And I just want to add a couple of things to this. We also recommend our clients to say that chat gpt dekhna band kar do. I think that should be one of the pointers in your workflow from now on.
Noted.
Yeah, moving on. See, मैं अपने पेशेंट से कैसे बात कर रहा हूँ अबाउट लेजर्स इज वन थिंग.
Yeah.
हाउ माई असिस्टेंट, or my reception desk, or my treatment coordinator, or even my associate, in my absence or even in my presence when I'm handling another case, how do you see that particular system working while you talk about lasers? क्योंकि सिर्फ मैं ही अगर एज अ डेंटिस्ट मैं ही अगर लेजर्स की बात करूं, that doesn't make much sense.
Yeah.
My entire team should be on the same page while talking about lasers. And how do you train your team? What is that strategy, and what is that goal and mantra that you have, while communicating the entire laser theory to the staff?
I don't tell my staff to sell lasers.
Okay,
That's what I do.
yeah, that's the gold point.
That's the goal point. I never tell them to sell lasers. I always tell them to introduce to the patient it as a kinder option.
Okay.
And I tell them to do not use any medical jargon. So they say it in a very simple language. They say, instead of this, we have this thing and we have lasers to make it simpler for you. They will talk about the outcome. So the whole clinic talks about the outcome. That's what we do differently. And in the practice huddles, they also know what not to promise. Okay. So the introduction is their part. They will introduce, ki, okay, we are doing certain these things with lasers. However, ma'am will decide and ma'am will be talking about whether it's right for you. So that's how we work around it.
Perfect. And मैंने ये क्वेश्चन क्यों पूछा, because as a clinician I see that patients have this hesitation, that hitch when they want to ask a question directly to the doctor. कई बार पेशेंट्स ना डॉक्टर से नहीं पूछते हैं, उन्होंने कुछ सुना होता है बट वो कई बार सिर्फ रिसेप्शनिस्ट से बोल रहे होते हैं या एसोसिएट से बोलते हैं, समबडी हु दे थिंक इज़ मोर अप्रोचेबल, उनसे पूछ रहे होते हैं कि सर लेज़र का क्या है, लेज़र्स कैसे होते हैं, क्या यहाँ पे लेज़र्स हम करा सकते हैं. सो उस पर्टिकुलर माइंडसेट को अगर देखें तो दिस इज़ द परफेक्ट पॉइंट वेयर आई फील कि every person in your team should know and have the right knowledge about lasers.
So I have a very good thing to add to this. How do we make it this way that it shouldn't sound theoretical or it shouldn't sound salesy? So whenever there is a follow-up call, if the front desk is taking that call, my assistant and the staff is there with them. So they know what exactly the patient felt. So they know.
So you are proper shadowing them
Yes.
into the entire process.
So follow-up is very important. And I show them the results also. Okay, see, we were able to get this result in this time, and look at the patient, how happy the patient is with their healing. So when they hear from the patient over the call or through a review, they are actually living that moment. They know that it works. So when they are next talking to that another patient about it, they're already very confident, right? So they're not salesy. They're actually bringing in value. And that's the real thing.
Okay. Let's talk about the good part from the money perspective now. थोड़ा रेवेन्यू की बात कर लें. करनी नहीं चाहिए, अच्छा नहीं लगता, बिकॉज यू नो थोड़े से हम ईविल लगने लग जाते हैं व्हेन वी टॉक अबाउट मनी एंड ऑल. बट ठीक है, अगर मैं किसी एक डेंटिस्ट से जो शायद अभी अपनी ग्रेजुएशन या पोस्ट ग्रेजुएशन ख़त्म करके क्लिनिक ओपन करना चाह रहे हैं, कुछ ऐसा बताओ जो रेवेन्यूज़ में हेल्प करे. कोई ऐसे 5 क्वेश्चंस हैं जो लोगों को खुद से पूछने चाहिए वाइल इन्वेस्टिंग इन लेज़र्स. शुड दे इन्वेस्ट इन लेज़र राइट नाउ और नॉट? क्या उनको सर्जिकल मेथड्स पे पहले फोकस करना चाहिए और फिर लेज़र्स पे जाना चाहिए, या डायरेक्टली लेज़र्स पे जाना चाहिए? इट्स लाइक क्या मैं हैंड फाइलिंग से आरसीटी कर लूँ या सीधा एंडोमोटर ले लूँ? काइंड ऑफ लाइक दैट. नॉट एग्जैक्टली, बट या.
So I think the first question one has to ask is that do I have enough patience to treat with lasers? Okay, so if you're buying the laser and you're not using it fully, it's underused and misunderstood, so then that is not doing any good. If it's lying in a box, not readily used, so then that should not be the thing for you. You should at least, if not every day, then you should use it at least 2 to 3 days in a week. So yeah, first thing, that do you have enough patience? Secondly, what are the most common procedures you use it for? So then you will be able to answer what wavelength will suit. So you want a single wavelength, you want multi wavelengths, then you can
मतलब
I don't know.
डेंटिस्ट्री के बाद फिजिक्स पढ़नी पड़ेगी.
Definitely. Laser science is not magic. It is. I'm coming on to that part. Third thing, whosoever you're buying the laser from, are they providing any hands-on training? Is there any mentorship also involved? So that is very important part. You are not just a laser owner. You have to be an expert, because whomsoever treating, you will, if you're not using a blade, then you will be using a laser and burning them. So
Right.
yes, so you have to master that science. So third point can come that you have to see whether you are getting the hands-on training and the training hours. And then fourth most important part, why are you buying it? You're buying it for the patient. So will it add on to the patient experience? That And the last, fifth question, if I can think of, is your team trained? That's the very important thing.
Right.
You, like you said, you just cannot be talking about lasers. The whole team has to be in sync.
Right.
So these are the 5 things I think you should.
And if you were to ask me this question, I would say it's like a tool. You can either use it like a pencil or you can use this like a sword. So I would say if you have the trust and faith in yourself, and when you feel that, if you think that you can treat the same way, the way you treat your family with,
Yeah,
then definitely go for lasers. Otherwise, pause,
definitely.
learn, practice, and then move on.
Definitely. Otherwise, you will do more harm.
Yeah.
People think, okay, I have Miss Laser, they have no training. They will not see what is the protocol. They will just start cutting. They'll see, oh, there's no bleeding, so nice. But then what they don't see is the damage,
Right.
the heat to the tissues. So when you cannot see what kind of damage you can do if you don't have the protocols in place.
Yeah. And more importantly, training is important because I feel just like marketing, branding,
Exactly.
business, कॉलेज में कुछ नहीं सिखाया ऐसे आई थिंक हमारे टाइम पे लेजर्स नहीं सिखाते
नहीं
थे
थे. It's
आई डोंट
not.
नो वेदर दे आर सम ऑफ द कॉलेजेस हैव स्टार्टेड दिस और नॉट येट आई थिंक देयर आर नाउ कॉलेजेस हु आर talking about lasers.
Yeah.
I'm not sure whether it has been rolled out into the entire curriculum across the country. So again, we are not sponsoring anyone, not the brand, not even where you should go for the right training, but you need to look up somebody as a mentor or somebody who can tell you what brand is gonna help you later on when you are going to invest in lasers. I don't think we have that answer for you as of now, although we have backstage behind the camera, but not in front of the camera or the mic at the moment. Moving on to my favorite question. थोड़ा सा devilish question है because I'm gonna talk about marketing now. Marketing in healthcare, I used to think that सबको करना चाहिए and advertise करना चाहिए and you'll get patients and whatnot. Now we have kind of diverged into a perspective where we are putting patient first. We are not putting doctors or healthcare system first as a company. Like this is something that I wanted to talk and speak a lot about it in the recent times, but I was somehow was not able to get the time for this particular conversation. I feel this is the right podcast to do that. So we as Likhani Healthcare Solutions now are moving to an age, an area where we want to commit ourselves for the betterment of the patient and not just looking at the healthcare practice itself. So again, I have a follow-up question to Dr. Manaswi. How do you see the ethical marketing, play the right role in spreading awareness about lasers? How do you see social media? How do you see websites? How do you see your own content journey? In promoting lasers, in talking about lasers, in talking about the fears, myths, and everything around lasers.
So, rightly said, fear is the biggest barrier to healthcare access. People are so fearful that they don't want to go sit in the dentist chair. And when you promote yourself as that I have bought a new gadget, be it laser or anything, you're not marketing that tool. You're just showing what you got new. However, the marketing that has worked for me will be something which is a problem solver, right? Like if I'm able to solve patients' fear problem, so that will be the kind of marketing I want to go in for. Like what I do for myself, if I want to talk about phenectomies, I will say I have a great option wherein we do sutureless phenectomies. We do scalpel less gum contouring. So when I'm doing marketing that way, I'm not marketing the gadget. I'm not marketing the technology. I am marketing the removal of a barrier. So when you ask me what I do generally, so I focus on marketing, which actually makes the person's fear or patient's problem first heard, seen, and then addressed. That will be the marketing which has worked for me. What I see around is a lot of other things. I don't want to say those right now. I
Give me 3
just
days, I can speak non-stop on that. But
you are the right guy to say about that. I can only speak for myself.
ओके, नोट ठीक है। तो एक पर्सपेक्टिव तो मैं समझ गया, बट एक दूसरा पर्सपेक्टिव है, इसको और थोड़ा एक्सप्लेन करते हैं। मान लीजिए कि मैं 25 साल का एक नया स्टूडेंट हूँ जो अभी बीडीएस एमडीएस करके निकला हूँ। तो मुझे अपना माइंडसेट कैसा रखना चाहिए? मुझे अपना सोशल मीडिया पे क्या मुझे देखना चाहिए, या जो लोग मार्केटिंग कर रहे हैं उनसे कुछ सीखना चाहिए क्या, अगर मुझे लेज़र्स को प्रमोट करना है? और इफ़ आई से कि देयर इज़ सो मच नॉइज़ अराउंड मी, a lot of people are doing a lot of things into marketing and calling it marketing. कुछ भी कर देते हैं and बोलते हैं देखो कुछ तो हो गया, बट क्या हुआ nobody knows.
That's true.
तो how do you see a person, कोई एक एडवाइस देनी हो फॉर द नेक्स्ट 90 डेज, किसी को अपना कंटेंट प्लान करना है, कुछ जर्नी प्लान करनी है, कैसे वो अपने आप को प्रेजेंट कर सकते हैं इन द सोशल वर्ल्ड?
So I'll give this as my own example. So when I bought lasers for the first time in my practice, I thought it's okay, it's going to be helping me solve problems. But what I realized was that how do I tell it to my patients? Obviously, I need to have certain patients to show the case, right? So I started understanding the concept of lasers. And when I started understanding that, I fell in love with lasers because I could use lasers to calm inflammation. I could use lasers in root canal. I could use lasers for pediatric cases, for teeth whitening, for aesthetic cases, for even orthodontics. List just goes on. So the thing is that you have to change your psychology as a dentist. The shift will happen only when you know you are not just a laser owner, you are an expert healer and you are there to solve a problem. Fine. So once you get to know that, whatever will follow will be good. So in the next 90 days, you can start talking to patients saying that you love the technology. Okay. It should not be rehearsed. Like I said, how your team should be, it should come from within. Okay. Once the patient know about that, they will go through that treatment and they will see that transformation. Once they see that transformation, they will be more than happy to talk about it, either a review written or a video testimonial. When you have the video testimonial from them, you can share it with other people. The other people who listen to the patients, the first patient's testimonial, they will feel safe. They will already be ready to meet you and they'll be more than happy to be in that chair even before they have spoken to you. So that's a good way to start.
Right.
So the advice is that whatever you are doing, first get a written consent. Then you start documenting. Start documenting the photographs before, after. Start documenting the procedure that you are doing. Then you can share a video talking about it, either through a background roll or you doing the treatment
Right.
and with the text animations. You do that. Thirdly, you put the patient testimonials. So once you start doing that, everything will fall into place. The next part of it, what your team will handle is once you've done that, they will have to follow up with the patients. So make sure you're getting enough reviews about lasers, both written and testimonial. And the closing line will be that you yourself should know that what soft promise you want to give to the people. And you have to be consistently talking about that. You have to have a clarity what message you want to put across and just start making content around that. One very important thing, don't think that you have to get viral on social media. So the biggest people who will actually choose you will silently DM you and not be liking your post. So don't go into that thing that, oh, I have to get viral with this. No, you're there to solve a problem. You're not an influencer. You're a clinician who has the perfect tool to help people. So that's exactly what you will do, and everything will follow. Trust me.
परफेक्ट। और अगर ये सब ना कर पाओ, then you can hire us.
Mm.
So I feel, whoever is watching this podcast or listening this episode somewhere in the entire country, now you are getting a hang of how laser dentistry works, how you should market, and how people in dentistry who are, as great as Dr. Manasvi, are managing their practices, their patients, and the curse of AI in today's time. I would like to thank Dr. Manasvi for coming and joining us on a very short notice. This is me, Dr. Girish Likhiani, signing off. See you soon. Goodbye.